Hi students, and welcome to the first lecture in HDFS 317. Today we have lecture 1.2, which is about the special needs past and present. Here we have just a little outline of our lecture. First we're going to do a little bit of a course overview, then we're going to discuss the history of early childhood special needs, foundational principles of practice, and then some notes on inclusion. Let's start with our course overview. Here we have our course description, and again, this is HDFS 317, Special Needs in Early Childhood. So let's just review this description together. You can follow along. This course enhances students' knowledge of atypical development in children birth through third grade. So this is that 0 to 8 window. And additionally, the course includes recommended practices for assessment, intervention, adapted instruction and materials, and inclusive environments to facilitate children's attainment of educational goals. So now that we've been able to review the course description together, I want to make a couple of points on some of our expectations for students coming into the course that are going to allow them to really get the most out of the topics that we're going to be reviewing. So the first thing is that the HDFS 317 really relies on students' prior knowledge of those theories of typical development and the types of influencing factors that basically impact how a child's developmental trajectory takes place. And we're specifically interested in that 0 to 8-year-old window, and we're looking at development in all domains, so speech, cognition, language. If you take a look at the course syllabus, you'll have a good sense of the different domains that we cover in this course. And so if at any point you're having challenges with understanding the content, go back and review some of those typical developmental trends that you've probably learned about, and that'll be a good foundation for moving forward with the course content. Linking back to that course description, we do note that we're looking at different modifications or adaptations that we can make to the environment to really support the child's attainment of goals in that setting. And of course, the course description says educational goals, which looks very different depending on the age of the child. So again, that setting and the goals or education vary by age. So you'll see there that younger than 3 years old, we're really looking at that home and family setting. So what can we do in the environment to help that child learn and develop and grow? And older than 3 years old, we're really looking at the educational or intervention-based settings. And then I just want to point out that materials and content build on one another throughout the course. So especially these first two modules really provide the foundation of understanding that we need on the topic of special needs as a whole, that then help us understand all of the later modules, such as the types of specific adaptations or modifications we might make to an environment based on that specific developmental domain that we're focused on. So let's take a minute here to talk about the significance of this course topic being special education or special needs in early childhood. Why is this important? And the first and foremost thing we want students to know is because early intervention works, and we want people to know how to give children the best start as early as possible. The topic 1.2 video specifically about the IDEA Act just really shines a light on how children with disabilities have historically been treated and the notable benefits that they experience and bring to the community at large when they get the supports that they need. And so it's really important just to recognize that and take in all the information you can around why early intervention is important. I know that I personally have based my whole career in some way, shape, or form on this idea of special education or special needs in early childhood and how we can use early intervention to support children and families. In my work as a therapist or Part C provider, my work as an instructor for you all, this topic has been the foundation of my career. And so I invite you at this early stage in the course to really consider, why did you take this course? And what is the relevance of this topic to your future professional or personal goals? Because oftentimes in my experience with this class, students do have some motivation for taking it. While it's a requirement in some ways, you can really push yourself to think beyond that about how is learning more about children with special needs going to benefit me? And think about if there are any of those personal or professional incentives. For a lot of people, it's they have a child that they work with that has special needs and they want to learn more about how to support them. Or they know that professionally they're going to come up in this topic down the road. And I really want you to connect with this because oftentimes that builds a higher motivation for course participation when you can really know the benefit and the gains that you can expect to get out of understanding this topic. So just a couple of pieces on that. So moving forward with this idea of what you can hope to get out of the course, really we see that this course provides a foundational knowledge for providers in various professional roles, often that are integrated into these settings or environments that we've discussed. So some of those professional applications may include the various list of providers here that I've provided. Each and every one of these roles has the potential of interacting with a young child with special needs and their families. And so to get that foundational knowledge is going to support the work that they do in that area. So if one of these is a profession you've been considering, I really encourage you to think about how you may be able to apply what you're learning here in the course. We also know that early childhood professionals have many roles and that they need to address development as a whole. So in covering all of the developmental domains in this class, we want to give students a good foundation for being able to look at that child's development in each and every part of it and think about how they may impact that, even if it's directly supporting a caregiver. So we provide lots of information on that as well. We also know that providers are going to be working on interdisciplinary teams if they are working with children with special needs. This means that speech-language pathologist needs to understand the role of an occupational therapist and how they're specifically addressing development so they can effectively team and coordinate and support one another's work and ultimately that child's development. We also take a broad perspective on inclusion in this course, meaning that even if you aren't directly planning to interact with young children with special needs, you're part of a community that has those members within it. And so we want to encourage you to have a good understanding of the types of struggles or strengths that these families can offer the community, and so you can know how you can support them. Special needs in early childhood really focuses on giving students awareness of the types of competencies that are required for working with a child with special needs. And there's a really great reference for this on Appendix F in the textbook. And it specifically states the different competencies for early childhood special educators, which would be in more of an educational classroom setting. However, if you take a look at that appendix and see the different skills that they're talking about, you'll really see that they are applicable to a wider group of professionals. For example, one of the competencies is appropriately assessing children's strengths and needs. Well, that's a skill that's really going to come in handy with any provider's role. For instance, in my role as a marriage and family therapist, I'm really looking at that children's strengths so I can talk about that with the parent to increase that parent's sense of understanding what their child's capable of and viewing their child as competent. And so again, just a nice list for a baseline understanding of the types of competencies we're trying to encourage throughout the course. Now we're going to briefly review some of the learning materials that we're going to use in the course, starting with some of the readings. And first, of course, we have the textbook, which is Adapting Early Childhood Curricula for Children with Special Needs. And this course textbook really provides a nice history and general overview of special education for all ages in early childhood. I want to point out that students are able to use the e-text or the hard copy, whichever they prefer. And this textbook is really great as it specifically focuses on that adapting curriculum in the educational setting, emphasizing more of that 3 to 8 year old window. However, we're going to have lots of opportunities to emphasize that 0 to 3 age range as well. And while the emphasis they place is on the educational setting, many of the strategies, as we've previously talked about, can be applied to other professions as well. And that's students' critical thinking skills are going to really help them connect that to different professions. And we also are going to be using CSU course reserves. This is going to be accessible via the CSU library website or our Canvas website. There's more information on how to access those readings in the syllabus. And a lot of our additional readings are going to be available here and should be pretty easy to access. Most students are familiar with that. Want to point out how we use videos in the course. Given an online format, videos can really enhance students' understanding of topics that they might be reviewing in the lecture or the readings. And other times it's really meant to be the sole way in which they access new content. So readings are going to be really important videos, as they are incorporated into course assignments such as discussions and quiz questions. So make sure you're always watching the videos. And here in the lectures, I'm going to do my best to really link in what benefits students are supposed to be getting from the different learning materials, whether it's a video or an applied activity. So lectures in this way are more of a summary of the content, where I'm going to highlight different things that are really important that I want students to make sure to take away from the topic. I'm also going to add in some case studies and my own professional experience again to build their understanding. But it's really meant to be more of a summary where you're learning to connect the different materials from the course module or topic and understand how those link to the general course objectives. So lectures might be a little different in that way than what you might be used to in an on-campus course. Lectures are meant to be reviewed either before or after reviewing the other learning materials. Again, it just depends on personal preference, so I'll let each student decide that for themselves. And applied activities, I know I mentioned, may be just handouts or different exercises that really aim to increase a student's performance as a professional around these topics, oftentimes encouraging self-reflection or practice with applying some of the practices that we'll discuss. And just, so I want to make sure that students know the direct grading of these learning materials is often not something that's done. However, these learning materials are the main way that you get the information that you need to be able to actively participate with the course. And these are the main ways you'll be engaging in the course topic. So feel free to ask if you have any questions about this. Person-first language is going to be a big part of the expectations for students in this course. And as it states in the book, person-first language is really where we emphasize a person's abilities and strengths versus their diagnosis. And this is going to be incorporated into all the grading of the class because really our words are critical. We're really shaping the perceptions and attitudes with our words, especially when discussing these vulnerable populations or a parent's child. And so we want to be setting a good example to the families in the community about how to discuss these topics. And change really comes from viewing children and families as capable, hence why we really want to stress one person's abilities and strengths. And so just an example here of this is that we would say a child with, say, autism or a child with Down syndrome. We wouldn't say autistic child. That's kind of outdated language for our professional realm. So keep that in mind in both your discussions and your writing and even the interactions that you're having with people outside of the course. Now we're going to briefly review the history of special needs in early childhood, looking at trends in both services and policies that have shaped the field today. Again, students are going to get the most information from their readings and the videos about this. I'm just going to help make a couple of points more clear. So there's been a variety of influences on the special education field from some of the first intervention attempts based out of early childhood education theories and general theories of development. And the text does a really nice job outlining this, so I won't go into that more in depth. But I do want to point out that changes in our knowledge have dramatically impacted the approach we take towards supporting individuals with special needs, and you'll see that as a theme throughout all of the materials in this topic. And that change in understanding has really trended towards early intervention, like we've already reviewed. And so this is really starting sometimes as soon as pregnancy for a potential at-risk mother or family. And here's just some examples of different programs that we see that really address that early intervention piece. So nurse-family partnership, which works with mothers and fathers as soon as they're pregnant through that child's second year. Early Head Start and Head Start programs, and early intervention, or Part C, that we're going to learn more about. So these are all programs that have come out of that change in our understanding about the importance of early childhood. Just wanted to briefly go over a timeline in the changes of our thinking, really just to stress to students that this is recent things that we're talking about here. It hasn't been that long since some of these changes have occurred. So the first one being in the 1930s, so less than 100 years ago, this idea of inclusion began. So up until that point, most children with special needs were being institutionalized, and you'll get a lot of good experience with that topic throughout the course module. In the 1950s and 60s is the first time that we realized the brain can grow and change and that it's not fixed. Again, think about how recent that is, that we just developed that idea. And now with all that we know about neurology and how the brain does grow and change and how it's impacted by different experiences, it's absolutely unbelievable to think that just this long ago, we didn't even know that the brain could really grow and change, and we had just started having that idea, which of course is very much central to the work with these special populations. And just in the 2000s here, as the importance of early childhood experience, toxic stress, and some of these early brain architecture concepts come out, where we really know that it's easier to build the brain right from the start than to fix it later on in life. And so we now know that there's a certain amount of stress or negative experiences that put children more at risk for developmental delays. So we're really trying to get in and be preventative on those risks, or if they are occurring, address them as soon as possible, so that child is more likely to build the foundation of knowledge that they need from the start. Throughout the course topic, students got a lot of information on the role that legislation has played in our current development of standards of practice. And just want to bring your attention to a couple of materials that are exceptionally helpful in this topic. The first one being that video about celebrating 35 years of the IDEA Act that really does a nice job of tracking the different legislations and how they impacted children and families. I also want to direct you towards the textbook. Exhibit 1.5 on page 15 has a nice overview of the legislation as well. And again, students are expected to understand those topics. But basically, there's a general trend that we wanted to transition children out of these institutionalized settings and towards inclusion and teaching. And we're still on that trend today. And as far as legislation changes that heavily impact our coursework here, I want to bring your attention to two important outcomes of the IDEA Act. So the first one that you see on the left are those Part B 3 to 5-year-old services. So this started in a 1986 revision of the IDEA Act. And this is where students create an individualized education plan in that school setting. And again, families are really leading that. This is what we call special education, and this continues through a child's schooling. And so it starts at 3 years old in that educational setting and goes up to 21 years of age. But here, of course, we're focused most on that Part B 3 to 5 or 5 to 8-year-old services. And what this does is this legislation mandates that a school district is to provide a free and appropriate education in the least restrictive environment for a child who has a developmental delay. Part C emphasizes the importance of supporting children in that 0 to 3-year-old window. And this started in kind of 1991, 1997 is the two main legislations that created the Part C as we know it today. And again, let's just remind you all that that's less than 20 years ago, or 20 years ago as of 2017. And that's pretty new stuff. So here we create individualized family service plans for that natural environment in the home setting. And this is what we refer to as early intervention. So both Part B and Part C are really going to be big topics in this course, and we're just briefly introducing them here, and you're going to get lots and lots of information on this moving forward. So while we always want to be using that person-first language, we do need to have some way to assess how children qualify for special education services. So this is different depending on the area that you live in and how that specific county may implement legislation, but here's kind of a general overview that we can use to understand this for the course. We have different categories of disability under the IDEA Act that help us establish if a child needs services for Part B. And so that handout that students are going to be reading for this topic 1.2 gives a really nice description of those different categories and how a child may present themselves if they're struggling with any of one of those categories of development. But the key here is that in order for them to gain special education services, that disability or delay must interfere with their ability to gain an education in that standard general education setting. So that's a really important part of that. And for Part C, it's a little bit different. We think of more of the general domains of development, such as the ones we're going to be covering in the course. And a child, in order to qualify, needs to have a 25% delay or greater in any area of the development. And it could be more than one, but at least one. And the cool thing about Part C, at least here in Larimer County, is that once you qualify, you are able to access those services regardless of level of delay until the child is 3 years of age. Because we know that while it's great a child can get on track developmentally, it takes work to maintain that progress and to stay there, and families can still benefit from that support. So that's a really great thing about qualifying for services in Part C. And again, that handout comes from this website, parentcenterhub.org, which has excellent information that's easy to understand and distribute to families who are really navigating this system that can at times be complicated to understand. And so having a place to turn to for some resources is highly valuable. And for students, this might be something that could help them in some of their assignments. So keep that in mind. So now we're going to briefly review some of the foundational principles of practice that came up in the text. Here's a very important slide for students, and I want to bring attention to Exhibit 1.2, which comes from your textbook reading. The information on this exhibit are very, very important to students' long-term understanding of this topic, as these are the foundational principles of practice for special education in early childhood. And we should become very familiar with these, as every suggested strategy or suggested practice that we're going to be discussing throughout the course really links back to these foundational principles. And as we go through the domain-specific modules, such as social and emotional development, we're going to be linking those practices that we talk about there back to these general principles and trends. So really, students are expected to be familiar with these. And we will discuss, though, how they're modified and applied to the specific areas of developments through case studies and personal examples. So you're going to get support with learning these, but really nice to get a good foundational understanding so you can be able to become more familiar with them and identify them on your own. And you are going to start to have practice identifying these as soon as this module, actually, in some of the case study videos, next topic, and our discussion as well. So take a look at these. I also want to bring attention to the influence of NACCE, which if you've worked at a childcare setting, you may be familiar with this. NACCE is the National Association for the Education of Young Children. They have had a huge influence on promoting developmentally appropriate practices. And this is another topic that we're going to be continuing to discuss throughout the course. They define developmentally appropriate practices, or DAP, as considering the following three components. So when assessing what practices are appropriate for a child, we need to look at their typical development at each age of that child. So say a child's 3 years old, what are children typically doing at that time? Then we need to combine that with knowledge of the individual child, including their strengths, challenges, the context of their living environment, so on and so forth. And then we need to make sure that the practices we're suggesting are culturally appropriate and endorsed by the family. So there's going to be an emphasis here on developmentally appropriate versus age-appropriate practices. When we're working with children with special needs, oftentimes the skills that we're working on are not what one would expect for that child's chronological age. So we have to put more emphasis, again, on these three components of what are developmentally appropriate practices to be using. So entering into our last topic of the lecture, we're going to look briefly at the idea of inclusion. And this is going to come up throughout the course, and the text provides a good introduction to this topic as well as the videos. And I really just want to stress that in this course here, we take a broad perspective to the idea of inclusion, which means when we discuss it, we're thinking about inclusion in the community, inclusion into the family setting, and inclusion in educational environments as well. So does inclusion work? Yes, we know it does. We've got lots of good research on this, hence why since the 1930s when this idea came up, we are continuing to encourage inclusion of children with developmental disabilities into these three settings that we're talking about. And when this happens, we know that there are increases in a child's cognitive abilities, in their language and communication abilities, as well as their motor development and social competence. So that is a broad range of benefits right there. We also know that children with typical development benefit from being in these inclusive environments, as it increases their sensitivity to individual differences, which is a lifelong skill that children can have. So these are just two of many pieces of research that support this idea. So we know inclusion is good for children and all children. So why are there challenges? This comes up for a variety of different reasons, and the text does a nice job of addressing the challenges that can come up in educational settings, but we know there's also challenges to including children with developmental disabilities into their natural family or community settings as well. And just to kind of state one thing on that educational front, that a big challenge to inclusion here can be the lack of training or support to the providers. And if you plan to be in early education, you can expect to work with children with special needs. Hence why this course is important and relevant to your future in this way, because we want to make sure students aren't totally caught off guard when they enter that environment, that they are going to be working with children who have all types of varying needs. And it might be an area where you seek additional training and supports as well, as it's a big topic for a lot of professionals. But addressing that natural settings piece, we really see some of these challenges in my work as a Part C early intervention provider, that these natural settings can come with their own issues around confidentiality, stigma, cultural acceptance, display of challenging behaviors in public, etc. So a way that this comes up for me is as a provider, when a family comes to me, they often have challenges with the public display of behaviors. So something that families will struggle with is being able to run errands or go to the grocery store and things like this. And that's because of that stigma and all of these different factors. So part of our work together is sometimes going into the community in those settings where we can give the family strategies and support around managing that child's behaviors or needs in that public setting. But then again, you have issues with the confidentiality. So again, it's an area that families need support with, but there are barriers as well that really just have to be addressed with each individual family. And again, we've come a long way in our understanding of the why, how, and when to include children with special needs, but we're still working on it. We're still developing that acceptance and breaking down some of those barriers that we've just talked about. And we really want to empower families so that can lead to more inclusion for the child. Like I said before, working with a family in that natural setting really empowers them to feel more comfortable including their child in the various different settings that they engage in. And so it's important to just note that those challenges are there, but the benefit outweighs the barriers for sure. Something you'll get to know about me is that I view the world in continuums. And so with this idea of inclusion, I think of anywhere on this range from on the left where we have absolutely no inclusion. This is a very isolated child and family. In the past, we may have thought of institutionalization on this side. And on the right side, we have full inclusion. And the video from the text or from the course topic has a good example of what that can look like with the amount of technology and things that are used to support children to be fully included into those educational settings. And in this course, we really review modifications and adaptations that can support children's inclusion into those family and educational settings. And students can think about how this even applies to their community at large. But our hope is that by taking this course, you will feel more comfortable promoting this right side of the continuum for children and families. And remember, we're talking about inclusion in these 3 settings that we're going to be continuing to address. Here's just some examples of inclusion that happens in the community setting, because that's sometimes one of those areas that we forget about. So here we have an example of adaptive activities and recreational things for children, such as skiing or water sports, Special Olympics. Those are things that happen in our community that support the families of children with special needs to get them involved and participate. In this middle picture here, we have Caroline's cart, and it's kind of a hard picture to see, but this cart was invented to support families that have children with special needs that are bigger than would maybe fit in that typical cart at the grocery store. So they can bring their child out into public and do the things that they need to do to continue on with daily life and make it just a little bit easier. So that's a beautiful example. I just saw they have one at King Soopers here in town. So really excited to see that because it's kind of a new thing. And then, of course, on the far right, this is an example of a community park that has chosen to put in an adaptive swing, kind of similar to the shopping cart where a bigger child could fit and easily enjoy the park, similar to their peers. So just some examples of things that you may see that you want to, that we all have the choice if we want to support or not. So my hope is throughout the participation of this course, you'll see your role in supporting inclusion on that community level. And just a quick note on some of the video resources that you're going to be watching. The first one, engaging students with disabilities early on. This is just a really nice video to highlight the progressive version of special education. It also stresses the importance of technology, which is an example of one modification that someone may use to support a child with special needs. And here they focus a lot on children with learning disabilities like dyslexia, but of course the general principles can be applied to children with various different disabilities. And just to point out that the use of technology too is very, very common even with young children. Oftentimes young children are using iPads with communication programs or social stories. There's things like communication switches. So while the topic is a little bit older in the video, keep in mind that this definitely applies to the young ones as well. And the video titled Children with Disabilities Neglected, this highlights that current institutional issues are not just a past problem. Really, we still have families who this is something they're fighting the stigma and expectation around still here today. And so this to me highlights what inclusion looks like on that family and community level. It also highlights the importance of including family and support services and remembering that we oftentimes support the child's development through our work with the family or the parent. And this video highlights a family that really wants to be that advocate and teacher for their child and would benefit from having support and knowing how to do so. Here's our references that we used in the course presentation, and I hope you enjoyed what you learned.